In this video, I'm going to talk about 3 factors to consider before you start exercising if you or a family member or a friend is suffering from long COVID. Hey everyone, welcome to the channel. Ed DeBoo, physical therapist out of Integrated Physical Therapy in Bellingham, Washington. If you're watching this video, you may be one of the over 20 million people estimated just in the US alone that are suffering from long COVID. And I feel you, because it is a debilitating condition. And I've got clients that have long COVID, and it's critical that we approach rehab from a scientific standpoint with the best knowledge that we have available so far. There are obviously many things about COVID that we don't understand, and the challenging part is that no 2 clients with COVID or long COVID present the same way. But the symptoms can be extreme fatigue, headaches, blood pressure issues, cardiac issues. I've had clients whose symptoms are mild and unfortunately very severe to a point where they can't even go back to work. Another challenging aspect of long COVID is it doesn't really depend on how severe the initial COVID infection was. So you may have had a mild COVID infection, recovered in a week or 2, and been doing fine, and then all of a sudden, boom, you crashed, and now you have debilitating long COVID. So as physical therapists, we're all about exercise, and we're all about a graded exercise program, which oftentimes includes kind of pushing the envelope a little bit. And if you're doing 5, maybe next week you should be doing 10. If you're doing 10, then maybe you should be doing 12. If you're walking 30 minutes, let's push that up 10-15%. However, a graded exercise approach for people living with long COVID is not a good idea. Like I said earlier, I have clients that I've been seeing for a long time that unfortunately are living with long COVID. And these are the 3 criteria that I put them through before we start any type of rehab or exercise program. So here we go. The first thing I like to do is rule out any type of serious cardiac issues. So if my client's having any shortness of breath or tachycardia, which is an elevated resting heart rate, or hypotension issues. So for example, if they're lying down and they sit up and they get really dizzy and they might fall down. Any type of chest pains or extreme shortness of breath or chest heaviness or pressure, I always have them check with their cardiologist first. One of the things that happens with COVID is blood clots. And like I said, everyone presents a little bit differently, but upon interviewing clients, if they have any type of those cardiac red flags, I say, look, go in, talk to your cardiologist first, get the major things ruled out, and then we'll start. The second thing I talk to them about is post-exertional malaise. Fancy acronym for basically extreme fatigue, worsening of symptoms after pretty mild or maybe even just mundane type of activities. Here's one of the many challenges. I have a client who, by the time they get up, they shower, shave, get a little breakfast, they are completely exhausted. So forget about going to work, forget about trying to exercise. They are doing just the basics, and that is still a little bit too much. So I'll just ask my clients, like, how do you feel? Like the last time you did something kind of semi-physical, how'd you feel? And if they felt okay afterwards, maybe a little bit of acceptable fatigue, then they probably don't have PEM. However, if they report, wow, you know what? I went and got groceries, and then the next day I could hardly even get out of bed. Like, wow, really? And that could be post-exertional malaise. Another factor about PEM is that it could last for anywhere for days to weeks, just from one bout. Not try to overdo it and put ourselves in the red zone. So you always want to leave a little bit in the tank. So if you are suffering from extreme exhaustion and worsening of symptoms after just doing small, mild physical exertion, then the action plan is 2 steps. The first thing I have my clients do is get a baseline resting heart rate. And I literally mean when you're lying down in bed. And so you can do it old school and check your heart rate that way. You can, if you have a wearable device, you can just get an idea of what your resting heart rate is. Do that for 3 or 4 days, first thing in the morning when you're still lying down. So then you get a baseline. It should be relatively the same. And then you know that's your resting heart rate. Now the idea is to monitor your heart rate while you're doing basic activities and try to keep the elevated heart rate no more than about 10 to 15 beats over baseline. We all know that when we exercise, our heart rate goes up, right? And normally it's no big deal. Oftentimes we want it to because we're getting a cardiac response. But with long COVID, we really have to be careful, because if we work too hard, well above that 10 to 15 resting heart rate for an extended period of time, like 10, 15, 20 minutes, we could be setting ourselves up for a big crash. Now I know life happens, and we're not always able to just stop and rest every time we want to. But if you can, the idea is to stop, rest, and pace. And the idea behind that is, rather than thinking about exercising on the floor or even going for a walk, first prioritize what we call ADLs, which are activities of daily living. Maybe you need to get up, you need to take a shower, maybe you've got kids to take care of, maybe there's a little bit of work you need to do. Those things all need to come first before you worry about trying to get out there and do leg strengthening exercises or go for a bike ride or for a long walk. So you're monitoring your heart rate. Let's say your heart rate does spike up to 20, 30 beats over your resting heart rate. If you can, you're going to stop and rest. Now the rest can look differently. Ideally, you might want to lie down. Rest is not looking at your phone or watching TV, ideally. Maybe even meditate, put an eye cover on if it's daylight, and really try to rest and bring that heart rate down as soon as you can. And when you resume the activity, make sure that you're monitoring that and work no more than about 2 minutes, 3 minutes if possible into that elevated heart rate zone of more than 10 to 15 beats per minute, and then rest and bring it back down. The third thing I have my clients do is monitor their oxygen saturation rate at home. It's a pretty inexpensive device. You can probably get these for 20 bucks online. You've probably seen them before. They fit right on your finger. And basically what it does a pretty good job of being able to tell you the level of oxygen in the blood. Now, if you've got long nails or fake nails, it might not work as well. Take it on different fingers if you need to kind of get an average. But ideally, in a normal, healthy situation, you are 95% saturated, if not higher. So once again, get a baseline. Find out where you're at normally before you do any type of exertion. If I'm just resting and my O2 sat rate is like less than 95, I'm calling the doc, just because you have a pretty low saturation rate. And personally, I would rather the doctor or the nurse or someone give you the green light to make sure that nothing is really wrong. Let's assume that your O2 rate is above 95 at rest, and then you start to do mild exertional activities. Maybe you start doing some housework, or maybe you go for a little walk or something very mild and gentle. Monitor your O2 rate. If it drops 3% or more, once again, stop, rest, pace, and call the doctor, because you should not have a drop of 3%, but just by doing simple activities around the house. The other thing that I try to remind my clients living with long COVID is that we want to set the environment up for success. So all the basic things that make us healthy from a lifestyle standpoint, we still want to do to give ourselves the best chance to succeed, right? So we want to try to minimize stress. We want to try to minimize, or if not eliminate, sugar, guys. There's nothing good that comes from sugar, obviously, besides the taste of it. But from a cellular level, metabolic level, we've got to cut the sugar out, especially if we're battling some sort of long-term type of condition. For my clients that are able to start exercising because they've met all 3 criteria, first thing that I have them do is basically getting outside and starting to walk just a little bit. It gets you outside, it gets a little bit of fresh air. I'm making this in the summer, so it's beautiful weather outside, but that is usually where I have them start. Once again, making sure they don't push so far into the red zone that they crash and have that post-exertional malaise where they're laid up for maybe 1 day, 2 days, 3 days, maybe even a week, because they crashed, because they went too hard, they redlined, and they ran out of energy. There's still so much that we are learning about how to deal with long COVID and how to help people with long COVID. So I will do the best I can. If you have any questions, please leave them down below, and I will try to get to them as soon as I can. And in the meantime, if you are living with long COVID, please heed the advice of this video, because I have found it to be helpful with my clients. All right, everyone, take care until the next video.